Hello guys, I hope you'll be in good health. Today we are going to discuss this graphical explanation of OET writing discharge letter. So if you're a doctor or a nurse, this video is going to help you out to understand the structure of writing or the mechanism of writing a letter of discharge. And it's a conventional category. What we mean by conventional category, when doctor is writing to a doctor or a nurse is writing this letter to a nurse. For OET medicine, normally a specialist or a consultant is writing back this letter to the primary care physician. So normally in OET writing medicine, a consultant is writing back to the primary care physician. So in this case, if it is OET medicine letter, right? So we are not supposed to write it down social history. We are not supposed to write it down medical history or the patient past medical history, basically, or patient family history. In case if it's OET medicine letter, so these things should not be included. However, in OET nursing letter, if these things are relevant, so wherever it's appropriate to mention, we can mention this social, medical or family history. It's not the case that you may write it down right after the introduction, but let's say if there is some information related to social history such as smoker or drinker, and if we have some information in the discharge plan, we can write it down that particular history along with the discharge plan. Anyhow, the main course of discharge letter or the main structure of the discharge letter we'll be discussing over here. Let's say the body part of your letter of discharge, as some of the students are quite confused about the structure of letter of discharge. So here we try to explain this thing to you. First of all, let's say this is the format of the case notes, an inverted cone. What you can see, there is a lot of information that has been given to you in the ward stay. As you can see, I just have scaled it. When we scale it, a lot of information, maybe 1 page, half page, we have had this ward stay information. And then we have some information again with rehab. It's more than the discharge, but maybe less than the ward stay. And then we have a discharge plan. A very few points or very less information will be given to you in the discharge plan. Normally care for the wound, for example, if it's a surgical discharge, normally the guideline for the medicine that patient has to take or any other therapies that should be done will be mentioned in the discharge plan, maybe in 3 to 4 bullets. So when you transform this thing into a letter format, this is the case notes format and you need to write it down in the letter format. So it's your skill to summarize the word stay like that. You can see now this is a cone and this was inverted cone. Inverted cone basically should be written in the cone format now. So we can summarize the word stay as you can see over here. Just write it down, even full things only. Summarize this word history. No need to mention date wise, day 1, day 2, day 3. Just give an overview. Do not miss something that is eventful. Do not write something that is uneventful. And students do ask a question, if we have some information in the ward such as the medicine and their dosage and frequency, so if it's something that is not being continued till discharge, or if there is no side effects or it's not eventful, so we may write it down just an overview to that. For example, if we have anticoagulants, we have painkillers, we have antibiotics, so you can write it down just the name rather than mentioning categorically the name of the medicine. We can write it down. He was managed with antibiotics, anticoagulants and painkillers, right? So to summarize the eventful things of the ward should be written in a letter of discharge if it's a surgical discharge. If it's a medicine discharge, we have the presenting symptoms in the case notes over here and you should summarize those things like initially on this date he presented to my clinic with symptoms of pneumonia rather than writing categorically one by one symptoms as we write it down in a referral letter. So summarize the ward stay or summarize the hospital admission details. Then we have the rehabilitation. We do have a lot of information in the rehabilitation, let's say on day 1, day 2, day 3, day 4, maybe day 5. So again, we just have to summarize and write only eventful thing. We are transforming it into a letter format. Now these are some important points you must have in your mind. followed by the discharge plan. Now discharge plan, you can see you have to expand. Treatment plan would be given, the medicine regime, the frequency, like say metformin 250 mg twice a day, like that. You have to write it down each and everything categorically. If there is some guideline instruction for the wound care, so we can write it down in the time after discharge. I would appreciate if you could ensure that patient wound should be monitored, blah, 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 blah. So you have to expand the given information in the discharge plan, and this will be a possible challenge for you because there is quite a few information in a discharge plan and you have to expand into a letter format. So to just summarize this information, in OET medicine, there is no need of writing social history, medical history or family history. Most of the time, there is one thing that we can add if it's a self-referral, mean that we are referring back to the primary care physician, but the patient was self-admitted, and if there is some information from the patient's social history, such as if he had taken some medication that caused these symptoms to happen, that's why the patient was admitted, then we can edit down that medication only. But most of the time, as it's being referred by the GP to the specialist, and now specialist is referring back to the primary care physician. So social history, past medical history, family history is totally irrelevant in OET medicine. In OET nursing, it can be written as per priority if it's a letter between same profession, doctor to doctor or nurse to nurse, right? So we are talking only about the conventional letter of discharge at the moment. And now we have a ward stay, we have to summarize them down. Summarize them down, just write it down even full. We have rehabilitation, summarize them down and write even full things. And we have a discharge plan, expand it. Do not miss anything from a discharge plan. It's a very important point. Either it's a dosage, either it's a frequency of the medicine, either it's some instruction. Do not miss it and expand it. It's very important for you to expand those details in the discharge plan. Remember that you can also combine these two paragraphs into one. The ward stay or the rehab can be combined into one. Similarly, if the hospital admission followed by the nursing care can be written in one paragraph as per the importance of the letter. So this is one of the most appropriate structure for your OET writing letter of discharge, but still with a caution that you must be having flexibility in your writing structure. With open mind, you can complete this writing letter. As long as you have a clear focus, here the main focus is the discharge plan. As long as you have a clear focus, whatever structure you will be following is totally fine. So I believe if you follow this format of writing in any of your OET writing letter of discharge, either you are candidate of medicine or nursing, it will be quite helpful thing for you to get a good score in your OET writing. So stay tuned with our YouTube or Instagram channel. We will be posting more videos related to the lectures of writing, speaking, reading and listening. There will be series we are starting. So I hope this is gonna help you out. If you have any question related to this letter of discharge, do not forget to comment on that. We are going to answer based on your question on this letter of discharge. Thank you.